Is there such thing as diabetic erectile dysfunction? And if so, what can you do about it? My name's Luke. If you haven't seen me before, I'm the lead men's health consultant here at Men's Room Shockwave. We treat a lot of different types of erectile dysfunction and we work with a lot of diabetic patients. And someone asked me recently, which I thought was a really good question, is there such thing as diabetic erectile dysfunction? And I guess the essence of the question is, can diabetes cause erectile dysfunction? In isolation, can there just be a type which is like, you've got diabetes, therefore you're going to get ED? So I'm going to hopefully shed a little bit of light on that for you today. Now, first of all, it's good just to understand the difference between the two types of diabetes. So you've got type 1 diabetes and type 2 diabetes. Most of the guys with erectile dysfunction are going to have type 2 diabetes, okay? That is the type where essentially your body has overproduced insulin for a long period of time. And because of that, the insulin sensitivity, the hormone sensitivity has reduced, which means that your body needs to produce more of it to get the same outcome. And as it loses its sensitivity, it means that it's not lowering your blood sugar effectively, which means that your resting, fasting glucose levels start to creep up. And that is what type 2 diabetes is. It's sugary blood and your hormones, your insulin isn't getting it down. Type 1's a bit different, usually associated with slightly younger people, although there's plenty of exceptions now. But it is just a case of the pancreas down-regulating, body attacking the pancreas. It stops producing insulin, and now you need to inject yourself with insulin instead of the pancreas doing that job. So you can obviously have erectile dysfunction and type 1 diabetes, but type 1 causing erectile dysfunction is a little bit less common because most of the time, type 1 diabetes is a bit easier to manage, it's a real pain for people to do it. But with, technology nowadays, especially with pumps and monitors and everything, you can keep that blood sugar pretty under control. And even if you're doing it manually, most of the time people do tend to do that. Type 2 diabetes kind of by definition has been unmanaged for a long period of time. So we've had sugary blood because that's how we've got to the point of being able to diagnose it. And it's within that sugary blood that we're going to start to see risks of erectile dysfunction. Why does it even cause ED? Well, sometimes it can just be a kind of chain reaction. Type 2 diabetes is essentially going to put you at risk of everything. And one of the things it's going to put you at risk of is high blood pressure. So if we're talking about how diabetes can cause ED, just giving you high blood pressure because of the strain that puts on your cardiovascular system could then create a possibility of getting something called vascular erectile dysfunction, which is essentially just associated with the cardiovascular system having poor health and then the inability for those blood vessels to dilate sufficiently to be able to get blood for the erection. However, another reason that we're going to see a risk of vascular erectile dysfunction with diabetes is because of that sugary blood. If you think, about where the smallest blood vessels in the body are. So any type 2 diabetic is going to know that the regular things they get checked are their eyes and their feet. The reason for that is because your eyes and your feet have very small blood vessels. And what your body's trying to do is it's trying to push what we call viscous blood through the body, which is essentially kind of like sugary blood. If you think about like honey or something like that, that's got viscosity to it. It's slightly thicker and stickier. You're trying to push that into very small blood vessels. It's a high demand on those small blood vessels. It causes damage, it causes inflammation, and it causes problems. The concept of the eyes and the feet for the type 2 diabetic is exactly the same as what's happening in the penis. The blood vessels are very small, very sensitive, and they actually have a really big job to do. And for that reason, the sugariness in the blood can then cause people to get vascular erectile dysfunction because it's damaging that microvascular system. So another reason that you might get ED because of diabetes is because the strain that is putting your body under can also lead to hormonal problems. So typically men that have got type 2 diabetes are going to be at more risk of something like low testosterone. If you're not sure what testosterone does, it's one of the drivers for an erection, okay? So different to the vascular system, which is actually, locally and structurally giving you the erection, the hormones are one of the things which drives it, and testosterone is a big, important hormone for that. So if you think diabetes creating poor health meaning that your hormones downregulate, you could then have a reduced testosterone level, which then gives you, less sexual appetite, less general energy, no morning erections, and that could lead to a diagnosis of erectile dysfunction from that. Last one then is something called neurological erectile dysfunction, which is to do with something called peripheral neuropathy. Now, diabetics might know peripheral neuropathy is typically in your feet, but again, this can be affecting any nerve. And it's the same kind of concept, really, that your body's trying to transport blood to a nerve, but that blood has got inflammatory components to it, and therefore it causes damage to the nerve. That's why we start to see the numbness in the feet and areas like that. But if we think about the very small nerves that go into the penis, particularly the pudendal nerve, we can cause damage to the pudendal nerve with a similar kind of process like peripheral neuropathy, but to that area. And if that nerve downregulates, that nerve is very important for giving you an erection in the first place. So the three main types of kind of diabetic erectile dysfunction, even though there isn't a proper diagnosis, that you're at risk of is vascular, hormonal, or neurological. Now, the thing with hormonal is that that's a little bit of a different process for trying to fix it, because there are a lot of lifestyle changes which you can make to try and actually get that, testosterone back up. And further down the line, potentially, is testosterone replacement therapy. For the other two, though, that's quite treatable in terms of actually improving structurally what's going on. So we do a lot of shockwave therapy here, which essentially improves the health of the blood vessels in the penis itself. And we do a lot of nerve stimulation, which gets those nerves firing and can actually start to reverse peripheral neuropathy. So if you think that you're falling into the category, you've seen like a slow decline in erection function, and you think it might be to do with something like your diabetes, it's absolutely worth dropping us a message. There's always going to be a link to our website or something below, which, you can always come through. You can either book a free call or you can just start a chat with us. We can hear a little bit about your specific case, see if it's something that we might be able to help with. And if you're in the South London, Surrey area, or people do travel from a bit further, but within that kind of catchment, and you want to potentially come in and talk to us about some treatment, it's completely free to be able to come in and talk to us about it too. So yeah, if you do think that applies to you and you're struggling with this, drop us a message or reach out and we're happy to chat.